Good afternoon.
Good
Judge Tucker.
afternoon, Mr. Chair.
Yes.
Donna Tucker from the King County District Court, and I brought along with me Callista Wellbaum, who is our therapeutic court manager overseeing mental health court, veterans court, and our community courts at this time. And if you have technical questions, I won't be able to answer them, but I'm sure that Callista will have an answer for you. But I also did want to let you know that I brought some others from the court with me here today, in particular Judge Lisa Paglasati. Judge Paglasati.
Where is she? Oh,
And she's going to have to leave before the meeting is over because she has court this afternoon. But Judge Paglasati just assumed the responsibility for mental health court after the governor appointed Judge Shaw to the Superior Court. So Judge Paglasati has stepped into the mental health court judgeship, and she has been working at our Redmond Community Court since its inception. So I just wanted you to get a chance to see her and meet her and know that she's working really well, and we're really glad to have her as a member of our court community.
I'm sorry. On that point, Councilmember Lambert has a quick question.
So does that mean you'll not be doing the community court?
She's still doing community court until you appoint me new judge, and I decide if and when I want to make a change at that community court in Redmond.
Well, I just want to say, Judge Paglasati, it is amazing to watch you in action. And your compassion, your professionalism, your dedication is amazing. So whatever we do, we need to clone you. So just be thinking about that.
Thank you.
How much does she pay Councilmember Lambert for saying that?
She, well,
She pays me by doing such a great job.
Okay.
Council Member Gossett, if you
yes.
went out to watch our community court, you would probably be saying the same thing.
Oh, okay.
And hopefully a community court will be coming to your community soon, and you'll be able to go, wow, that was really cool. And if I clone her, you will really do that. So I'm really proud of the first choice I made to do our community court. Has turned out really well. So.
Okay.
Also with me today, but they will not be speaking, but they are part of the mental health court team. And you have not met them because they're recently new employees to the court, and I would just like you to get a chance to see them, is the new Director of Probation Services, Regina Alexander. Regina? Regina comes to us from, she was the Director of Probation Services at Linwood and Bellevue, and we hired her just a couple of months ago to take over probation here in Director in King County after Judy Garcia retired.
How many probation officers do we have?
Regina, how many officers do you have? We have staff of 17. 17 probation officers. And also, I'd like to introduce you today to Megan Turley. She's our Deputy Director of Probation, and she is overseeing our mental health court probation program. She comes to us not from probation services, but from mental health services, having worked in, was it Indiana? Indiana, overseeing a community mental health program that worked with courts from the other side. And we were really lucky to find her as we were going through our search for probation services. So you'll also be seeing her around, and I am confident in their abilities to continue to move us forward in a positive direction as we do therapeutic courts and integrating that with our probation services. So I just wanted to give you an insight as to who they are if you see them around, and I wanted them to see you as well.
Okay. Thank you, Judge.
So thank you. And thank you for inviting us here today. The report that Samantha just provided to you was a report that was requested by the Executive Committee of the King County District Court Judges when we realized that we had not had an evaluation of the mental health court for a number of years to make sure that we were doing what we thought we were doing. And so we were able to, in conjunction with the University of Washington and the Department of Social and Health Services, do an evaluation of our mental health court. And I'm really happy to report that we're really very pleased with the work that's going on. And when I had a report out from the DSHS, I thought, wow, I need to really talk to the local politicians about this as a budgetary savings and issue that maybe the state needs to sort of help some more with funding. So That being said, my staff did prepare for me a brief history about the community court, which you are correct, Councilmember Gossett or Chair Gossett, that it was started in 1999. We will be having our 20th anniversary in October of this year. We'll be doing a 20th anniversary celebration, and you will all be getting invitations. And we have some musical people coming, and it's going to be a really great thing for us to highlight. And the purpose of this was obvious. Yeah, you can do that. Thanks. I didn't know it was going to come up one at a time. So it helps to increase the effective cooperation between the mental health treatment systems and the criminal justice systems. It was one of the first mental health courts created in the United States. The current mission of the mental health court is to engage, support, and facilitate the sustained stability of individuals with mental health disorders within the criminal justice system while reducing recidivism and increasing community safety. This court works only with collaboration, which is really key. That includes collaboration from the attorneys appointed to represent the defendants, the defendants' social workers who work for the DPD, the prosecutors and the prosecutors' victim advocates.
Who do the social workers work for?
The Department of Public Defense have social workers. The prosecutor has victim advocates that assist them in making sure that we're talking to the victims and that we're taking into consideration their concerns. We have probation mental health specialists, so all of our probation officers have advanced degrees, and they only work on these cases that are in the mental health court. And then there are court clinicians, and the court clinicians currently work under the supervision of King County Public Health. And they are housed specifically in this particular program. And then, of course, we have the judge, who's also a very important part of our collaboration. As you indicated, the study, was it a year or two that it took them to go through all the data? It was at least a year. They look for statistically significant individuals that they could use as the control group. They're very confident in their numbers. And so they compared the control group to those who are in mental health court. So the finding was significant that those who are part of the control group did continue to have recidivism rates at much higher than those who were participating in the mental health court, and that a lot of the individuals that we are currently serving in mental health court have really significant issues with some significant prior criminal justice involvement and or pending cases. So we have seen a 26% lower rate in new criminal charges from our mental health court participants from the control group, and that is for both felony and misdemeanors. So that obviously also impacts jail costs and so forth, and police costs in terms of reduced response to incidents. The lower incarceration, 28 fewer days in jail per case. So the individuals spent, on average, 28% fewer days in jail than the control group, which is also a significant budgetary savings. The inpatient hospitalization rate. So we had 56% lower rate of inpatient psychiatric hospitalization. Psychiatric hospitalization, as you know, is a big cost to both the state and the county. And those participating in the regional mental health have had a 56% lower rate. We also are seeing fewer emergency department visits, 44% fewer of the comparison group and the mental health court participants. Are we okay? All right. So I think that I know the district court is very proud, and I think that this county can be very proud of the fact that the regional mental health court is working. It's creating safer communities for us. It's lowering, we believe, costs pays to the taxpayers' costs. We know that it's getting better health and wellness for the individuals who are participating in our program who suffer from significant mental health disorders. And we also see that it's helping their family members have a greater peace due to fewer crisis and incidents with their members who are part of it.
May I stop you for a second?
You bet.
Could you go back to the chart right before that?
On the visits to the
Yeah,
emergency room?
Go back to the chart. No, that's not the chart. It just had 4 or 5. Anyway, let me ask about the question that I had. When you say lower costs to the county, are we comparing how much money we would spend if that individual was in the King County Jail versus the fact that he or she is in the mental health therapeutic court system?
Have I compared the cost of,
Yeah, when we said
would it be
court, it's
cheaper if
lower
you
to
just
the
put them in
county.
jail?
Yeah. No, that's what I'm asking.
I have not compared those costs.
But
I
what-
have not done that cost comparison.
But when you say lower costs, what are we
Mm-hmm.
referencing? I guess that's more what I'm asking.
All right, so when I talk about what I believe to be lower costs, I'm talking about the cost of incarceration, the cost of hospitalization, the cost of emergency room visits, the cost of people in the community becoming victims of a new offense, a new crime. Okay?
Yeah.
So I think that those are, if you, there's a cost to all of those things. The question is, how do you quantify that?
Yeah.
It's very difficult to quantify, but we can all understand it, right?
Right.
Okay.
All
Any-
right, thank you. That's
My
helpful.
pleasure. All right. So currently, the information that we're seeing from our stats is that we have, this next chart talks about the number of referrals. So these are people who are referred to the court, not necessarily who accepted in or joined into the court. And the categories up here, you'll see the Regional Mental Health Court, FDD stands for felony dropdown. This means that the King County Prosecutor's Office is currently referring cases to us for individuals who would be charged with a felony offense, but for the fact that they have significant mental health illness. And these are people that they believe can be better served by staying as misdemeanors in our system in King County rather than sending to the state prison for felons.
Absolutely.
And so this is our largest current referral group into the mental health court, which means we're serving people who have committed rather significant offenses, all right? But ones that have been identified that they're going to continue that pattern if there's not some sort of an intervention. And the intervention that happens through our felony criminal justice system in the state of Washington is not going to address it. And I think that this is where you're seeing a lot of cost savings. And I think that this is something that you should be looking to the state because you're saving the state a lot of money in not having to house these people or to deal with them as felons. The King County is saving the state a lot of money by processing these individuals through the local community mental health court as opposed to sending them to serve their time out in prison. And I think that you guys need to be aware of that and let the county folks who, or the state folks who look to fund things or not fund things, understand that this county is actually saving the state a lot of money by the choice that the county has made to prosecute these as misdemeanors as opposed to felons is a big savings to the state. And they should know that. We have our city partners as well, is the next largest group of referrals to the mental health court. We had about 22% of the referrals are coming from cities. So that's any city in the King County can refer an individual to the mental health court. The next category are people that are county responsible. So these are the people that are being arrested by the King County Police or contacted by the King County Police. And that's about 19% of our current caseload. Those are misdemeanor cases, meaning up to a year in jail, $5,000 fine are the crimes. We also have, and these are all coming to Seattle, we also have the Regional Veterans Court felony drop-downs. So these are part of our veterans that were not part of, were they included in the study? I don't think they were, just mental health. All right. So we have our Veterans Court, which also has a celebration coming up before long, will be approximately 15% of our cases. Those are felony drop-downs that we're dealing with that are veterans, and 23% are city referrals for veterans, and then 8% are county responsible cases. So you can see that the Veterans Court and the Mental Health Court is serving a broad population throughout the entirety of King County, not just what would be normally district court cases, and that it's having a lot of effect. So these are also the municipalities who are referring us their people, approximately 22%. They're also saving the same, they're seeing the same benefits that everybody else is. How much time do I have? Am I rambling? Mr. Chair, how much time? Or you cut me off at any time.
Yeah.
I'll just ramble and ramble.
We need to be educated.
All right.
We need to be as rapid as possible.
All right. We currently have 380 active participants working in the mental health court. We have 76 individuals who have graduated and or been released from the program due to other issues. So 76 graduations or people who had other issues that weren't revoked for some reason. They're out of the program. They may not have graduated. It was a very small number. Most of these are graduations. The 76, that was in 2008.
Wait a minute, 2008 or 2018?
2018, sorry. Thank you. We will be having our 20th anniversary celebration on Thursday, October the 10th, from 1 to 3 to coincide with World Mental Health Day. It will be housed in the Superior Court large courtroom so that we can have a really nice celebration in room E942. And we're sending out the emails at this time to ask people to save the dates.
Okay.
Happy to answer any questions if anybody has questions.
Thank you. If we have 370 folks that come in, I didn't understand at the last what you meant by 86 graduated. So does that mean of the 371 that started the program at the beginning of the year, just 86 of them successfully graduated?
That doesn't mean that they're not still actively participating. So the 76 that are no longer participating because we deem them either successful
Okay.
or we deem that there was other issues that was not going to allow them to continue.
Okay.
That's 76. There are many who are continuing to participate, and Callista can answer the actual numbers.
Good afternoon.
Good
I
afternoon.
wanted to let you all know that on any given time, we have approximately 210 people who are actively in our program. This stat from
Right
2018,
now.
yes, was that in 2018, we served a total of 380 people. So either people who were actively in the program at the start of the year and then anybody else who opted into the program. So that's what that stat means.
But how does those of us who, think logically and scientifically, how do we know what percentage of those 280 successfully got through the program?
So if you look at the slide on non-revocations, the way that we've split things up is into revocations, which is not the outcome that we hope.
Yeah,
Revoke.
meaning
And then non-revocations, which the majority of those are graduations. There's just a few other types of times when we would end someone's time with the court but not graduate. So as you can see by this slide, if you look at the yellow
Yes.
and the pink, sorry, the yellow and the green, you're
Yeah.
looking at over 50% of the folk have not been revoked.
And what does that mean? Did they succeed?
Correct.
Or
They either,
they either succeed or they're still in the
or they're
just
really
wanna be
close to
clear.
succeeding. Sometimes somebody won't get an actual graduation, but their case will be closed and it won't be revoked.
Yeah.
So our success rate, if you want to look at it that way, would be over 50%.
No, I mean, I appreciate what y'all saying
Yeah.
because in '99, I worked with Norm Maylene, the judges that were in charge then, as well as the public defense and the others. This was one of our first major alternatives to incarceration programs, and we have been served well by it. I've had family members and neighbors from my neighborhood and many other people that I know well that have been successfully served. I'm just trying to make sure that I have an appreciation and talking about it in the broader community. With one of the most difficult populations we had to serve, the mentally ill, who are also had charges alleged against them because they're not guilty until they're proven so. And this program has been very beneficial to you. I just want us to be clear on how successful you all think it's been, and then hopefully we'll hear about what you see as some of the challenges. But it's still your turn. I just stopped you.
No.
Are you just here to help answer questions?
I'm here to help answer questions.
All right. Members, do you have any other questions of her? What would you say are the main successes that you're most proud to talk about in relationship to our mental health therapeutic court here in King County?
Do you want Callista to answer that? Yeah.
Thank you for the question. I am
She's not happy with that question.
very proud of the work that has been presented to you today. I was hoping that we could show that the people who came through our court committed less crimes and that we were able to keep them out of jail more and keep them out of the hospital and keep them out of the ER. But I really didn't have any idea, and we haven't been evaluated since 2003. So when I started in
That's why
2000,
this report is so
yeah,
important.
when I started in 2015, it was my main goal to get an evaluation. And the fact that the evaluation has shown that we are doing what we say we're doing makes me incredibly proud of not only the work of our staff, but of the people who've come through the program, because it's an intense program. It's often 2 years, with lots of treatment appointments, lots of probation appointments.
Yeah,
So that I'm very proud of that.
thank you. Judge Tucker, was there anything you wanted to add to my questions?
No, I'm very proud of that, but I didn't know if you were going to ask the question of what do we see as some of our weaknesses. And I didn't talk to Callista about this, but I do know that last year or the year before that we ran into some major obstacles about loss of housing for people who are part of our mental health court. And this has been a really big challenge, and I think that out of all of the populations that we serve in district court, the folks who are in our mental health court need housing.
Yeah.
And when that was taken from us, it was a big blow. And when it came to us without any advanced planning, it was an even bigger blow. And so that's really, my biggest concern is that we continue to have support for being able to have the individuals that have really significant challenges in this community to have appropriate housing. And nobody asked me to do that, but that's just weighing on my mind.
Well, since you brought it up, what housing did you have that you have just indicated was taken away from you?
Since I've started, we've actually lost multiple housing contracts. We had a contract with the FACT team that disintegrated at Sound. We had a contract.
At Sound Mental Health? Okay.
We had a contract with Impact, which disintegrated at CPC. So we have been able to use some of those funds to get additional housing at Pioneer Human Services, where we have a
Okay.
contract with, but our need way exceeds the resources that we have. I'm very, very lucky that we have the housing that we do, because I know that many agencies and programs don't have any housing.
Right.
So I want to show my gratitude for the funding that we do have to support those in the court. But it's about 75 slots. And as you can see, on average, we're serving 210 people at a time. And the majority of the people that we're serving come to us in a state of homelessness. And so what's happening is that we're actually keeping people in jail longer than we would want to, so we can get them into housing, which is costs that we know we would rather them be out in the community, but we want to make sure that they're out in the community safe.
Right. Okay. Well, we appreciate what you, the judge, and the other program professionals are doing on behalf of this population, because we're the ones that get from the public, why are these, they use these terms like, I would never use it, but they use terms like crazy people. These are human beings who need some help. When you need help, you try to get it. They need help. We need to try to provide it. So it's an ongoing challenge. We appreciate the work that our district court is doing for this population group, and we look forward to continuing to be supportive of it. But it's really helpful when we're able to get reports based on, independent analysis like this. So we'll know what we have to do to continue to be successful and what some of the challenges are. Councilmember Lambert.
Thank you,
and then we
Mr.
have to
Chair.
move on.
So our probation officer said that you have 17 officers. So what is your caseload per officer?
So we have 17 total probation officers. Some of those are mental health court officers.
They have about between 35 and 40 at any given time on their caseload.
So the mental health court officers handle about 35 to 40 cases. And how many are there, 5 or 7? 5. 5 mental health court. The rest are mainstream probation officers, and their caseloads can range anywhere from 100 to 140 a month
140 people a month for a caseload officer?
on their, probation.
That is like way different from the state DSHS probation.
Yeah. this
Way
is-
less than that.
These are individuals on a caseload. Most of them are either DUIs or domestic violence related cases that are on our current probation staff.
I don't remember because it's been 17 years since I've been in the legislature, but it might be interesting to check their caseload and our caseloads, because I don't remember 3-digit numbers.
Yeah, the state officers have a responsibility to go out into the community. Our officers don't have a similar responsibility. They come to us. So that could explain the caseload, why the state has a smaller caseload, because they actually have to go out into the community, and district court municipal or misdemeanor probation officers do not have to go out and do investigation and service. So we do it off of the computer or when they come to us.
Okay.